Hello, welcome to our Health Matters webinar, Telling Big Stories on Hidden Risks. I'm Michelle Lavander, Director of the USC Center for Health Journalism. Thanks for joining us today. In this webinar, we'll hear from two crackerjack investigative reporters, Barbara Laker and Wendy Ruderman of the Philadelphia Inquirer and Philadelphia Daily News. As fellows with our Center for Health Journalism National Fellowship, they spent 3 years investigating toxic hazards in Philadelphia's homes, schools, and neighborhoods, making them safer for children and families. Along the way, they had adopted approaches more typical of environmental inspectors, roaming neighborhoods with a device for detecting lead in soil, taking swipes of homes to look for lead paint that could harm children's development, and convincing teachers in Philadelphia's aging schools to test for toxins to which children were routinely exposed. Their findings of widespread lead poisoning were backed up by environmental experts, and the series led the city and state to provide millions in funding to repair hazards in schools, widespread changes in how cleanup rules are enforced, and pledges of more than $100 million in cleanup funding by the state's governor. Today, you'll hear tips on how reporters can broaden their work to incorporate these creative techniques, along with the usual tools of the trade, our notebooks, cameras, and recorders. A word on our speakers, who have collaborated on projects for many years. Wendy Ruderman is an investigative reporter with the Philadelphia Daily News and Philadelphia Inquirer, who previously worked as a staff writer for the Associated Press and the New York Times. Barbara Laker, her partner in reporting at the News and Inquirer, previously worked for the Clearwater Sun, Atlanta Journal-Constitution, the Dallas Times-Herald, and the Seattle Post-Intelligencer. The two reporters won the 2010 Pulitzer for investigative reporting for a series about police corruption. They also co-wrote Busted, A Tale of Corruption and Betrayal in the City of Brotherly Love in 2014. Wendy and Barbara were 2016 National Fellows with our USC Center for Health Journalism, and their fellowship project, called Toxic City, won many major investigative journalism prizes and was named a Pulitzer finalist this year. This webinar is offered thanks to the generous support of the National Institute for Healthcare Management Foundation and the Commonwealth Fund. You can tweet about this webinar at the hashtag #ToxicCities. A word about our format today. We'll be hearing from our panelists first, and then we'll turn it over to you, our audience, for questions. Because we have several hundred people on the call, we'll ask you to write your questions into the control panel of GoToWebinar. You can write us there if you're experiencing technical problems as well. We'll be archiving this webinar at centerforhealthjournalism.org. Now, let's turn to our speakers. Wendy, Barbara, your investigation started with a very basic question. How many children in Philadelphia are poisoned by lead? Tell us, where did that first question lead you?
Well, what happened is when the lead and water crisis in Flint, Michigan got exposed in 2015, Wendy and I got to thinking how many children are actually poisoned by lead here in Philly. It turned out a whole lot. Each year, thousands of children are newly poisoned by lead, more than twice the national average, and at rates even far higher than in Flint. So we set out to learn why. The answer to that question took us on this very long journey that resulted in Philadelphia Inquirer's Toxic City, which was a 5-part series. The series examined how the city's children, many poor and minority, are exposed to environmental hazards in their homes, backyards, and schools. We never, ever expected to work on this for 3 years, but that's what it took. The first part focused on lead paint in old homes. It looked at how landlords shrug off city laws and kids get lead poison in the very homes that they live in. The city wouldn't give us names and addresses of children who had been poisoned. And so we thought, well, how are we going to get this done? We found the answer in Philly's lead court, where the city takes landlords to court in the most egregious cases. And we ended up looking at 3 years of docket numbers. In total, there were 705 cases. We didn't have names or addresses or anything, so we had to go to the courthouse and pull up each case by hand. We then created a database with addresses, and we just started going door to door, knocking on hundreds of doors. One of the families we found was a family with 2-year-old twins who were severely lead poisoned, so much so at the age of 2, they could barely say more than 1 or 2 words. When we looked at the landlord involved in this case, we were shocked because it was an NFL Hall of Famer, Marvin Harrison. And he'd actually owned 80 properties at the time. He was a multimillionaire. He'd signed a contract for 70 million with the Colts, but he wouldn't spend a few $1,000s to make sure the kids living in his homes were safe. Another hurdle we came across was how we were going to prove that the child was actually poisoned there in that home and not previous homes. So we needed the rental agreement with the move-in date and also the child's medical records. The city has a database of whenever a child gets lead tested, it goes into a database, but they were not going to give us any results that way. So we worked out with the health department that if the parents signed a waiver, we could get access to the history of all their blood tests with dates.
This is Wendy. This is another little boy we found, Jalen. He had a really high blood lead level, and he was severely disabled from it. At 9, he only could read at a kindergarten level, and we found out that his landlord was a Philadelphia judge who had actually presided over lead court cases and was ordered to clean up his house and hadn't done it. And so then, in knocking on doors, we encountered a family with a little boy who was severely lead poisoned. This is photos of the place where he had lived. This is the front foyer of his home. And what happened is the landlord was ordered to clean up the lead in this house, but the city really doesn't have a way to check up and make sure that it's remediated properly, that the lead paint is abated correctly. So this landlord hired untrained workers who took a blowtorch to the lead paint, and that actually aerosoled the lead. And we proved through medical records that the kid's lead level actually spiked after that because he was breathing in all of this aerosoled lead. And the father had taken a picture and saved it and provided it to us. When we went So the landlord did put fresh paint down, and you can see in the after picture the fresh paint in the same area. And a lead inspector came out to with the city health department, and he said that the house was safe, but we wanted to make sure that it was. So what we did was we knocked on the door. By the time we got there, there were new tenants living there. It was an older woman who had a little tiny grandson who came to visit her quite frequently. We asked permission to do some testing in their home. So Barbara and I had purchased these lead check swabs. It's like a little kit from Home Depot that only costs $10. And you swipe it against a wall or somewhere where you think there may be lead. And if it turns red, that's an indication of lead paint. So when I went to the house with my little kid, I didn't do the walls because they had painted over them, and lead really doesn't go away. You just sort of encapsulate it. I knew it would turn up red. So what I did was I swiped the floors because I was looking for lead dust, because during the reporting we learned that dust invisible to the eye was actually most hazardous to little kids. So the swipe turned red on the floor, and I asked the family if I could come back with a state licensed risk assessor, and you can see him here in the picture. He's testing a basement floor where the kids played quite frequently, and he's with Criterion Labs, a lab in Bensalem, Pennsylvania. So we had money, had a couple of $1,000s from the Center for Health Journalism to do testing. So this cost us $375 for an inspection, and he took 8 dust wipe samples, and 4 of them came back extremely hazardous for lead paint, or lead dust actually. I think it was 19 times higher than the residential limit set by federal regulations. And so we were able to demonstrate how kids get sick in the same homes over and over again, even when the landlord swears that it's cleaned up and the health department says it looks good to them.
So after the first part, we got a call from this mom here, Jana Curtis, a mom of 3, who told us that one of her children, her daughter, got poisoned in her own backyard, not from inside the house, but from her own backyard. And she asked us if we had thought of looking into that. And so that's how we started looking at lead in soil, in parks, playgrounds, and yards, in the River Ward section of the city, which had been this industrial hub, and it had like 14 lead smelters within a really tiny, like 2 square mile area. And so what we were looking for in this area is not only like all the old lead smelters were there, but the neighborhood was undergoing a construction boom, and it was gentrifying, and it was churning up what could be contaminated soil and spreading lead dust, what some people believed, including Jana, all over the neighborhood. And what made this piece unique is we decided to do our own soil testing. And we also decided to take it a step further and test stoops and playground surfaces for lead dust where children play.
So our data reporter, Dylan Purcell, the first thing he did was he mapped out all the locations of the old smelters. And then we hit the streets and we knocked on the doors of the homes in the area of the smelters. And we asked residents if we could test their soil. And so with the first time we did it, we got a list of people who agreed that we could test their soil. And we came back. Again, we hired a state certified risk assessor from Criterion Labs. And you can see her in the picture scooping soil. But the problem was it was really expensive and it was really time consuming. It was about $600 for an 8-hour day in the field for her work, and then an additional $25 for each dirt sample that she analyzed for lead. And she was using an XRF gun. It's like a handheld X-ray gun that measures the amount of metals in soils to do the test right on the spot. But the problem was because the ground was frozen, we started this in the winter, and the soil was so cold that it took forever for the XRF test to warm up the soil and actually register how much lead was there. So we ended up standing in people's backyards in the cold for like an hour making small talk, and we really wanted to do hundreds of tests. So clearly, Barbara and I knew this wasn't going to work. So we went to the lab. We went actually to Criterion Labs and we met with them and we talked to them about how we would do our own soil testing. And we got trained how to take soil samples ourselves. And we pretty much just hit the streets with shovels and sandwich baggies and labels. And this way we could split up and be more efficient with our time, but also be charged only $25 per scoop. So every day we drove to the lab with new batches of dirt. And you can see here, this is a picture of Barbara in the lab. She is actually entering in the address, location of sample, the time that we did the scoop, the date of the dirt scoop, and which we kept track of, like with a chain of custody logs that the lab had provided us with. So by the time this took us about 6 months, and the weather began to warm up, and I just remember that my car smelled terrible because contaminated dirt, piles of it back in my car just started to stink, and I remember having to like open up my windows while driving to the lab with all this dirt.
So all told, we ended up taking 500 samples of soil from 114 locations. And after all the tests were done, we were really, really amazed because 3 out of 4 soil samples had hazardous levels of lead contamination. And one sample, for example, taken from the backyard of a family with a newborn baby, came back at nearly 10,000 parts per million, which is 25 times what is considered acceptable. And the hardest part of this was something we totally were not prepared for, is giving bad news to homeowners. I mean, they had trusted us. They allowed us to scoop up dirt in their home, and we owed them, we thought, to go back to them in person and give them the results. And sometimes it was just horrible because they would cry. They'd be really upset because they had bought a home and thought they had this dream home, but turned out they had a yard that could possibly harm their child. So for this part, we blended science, street reporting, and stories of the people who lived there, some of whom had children who had been lead poisoned. We knocked on the door of this mom, Jenny Drozdak, and her husband, Dan Morgan. And they had known about the neighborhood's toxic legacy when they purchased this house in 2011. They'd even paid $600 to get their own soil tested, and it came back high. So they installed raised beds because they were big vegetable gardeners, and they put in new topsoil to grow vegetables, and they put down a thick layer of mulch throughout the rest of the yard. So when their daughter, Mina, was born a few years later, they thought she would be totally safe. But then the construction boom hit her neighborhood. And every time I was at her house, you could hear the bulldozers all around. There was dust everywhere. And Jenny had Mina's blood level taken when she was a year old, and it came back high at 9 micrograms per deciliter. And so we wanted to see if the construction was to blame. So Wendy and I staked out construction sites all around, all in this neighborhood, and we saw workers failing to take any dust control measures at all required by law. They never had the soil covered or wetted down, and we wanted to see and prove if the digging was actually spreading toxic lead dust to their stoops and playgrounds.
So we went back to the lab and we spent a day learning how to take dust wipe samples. And this is Barbara getting her lesson. And we basically, what we did was we wanted to sit on site, and before they started construction and started digging, we tested surfaces, and then after they were done and they started digging foundations, we retested the surfaces. And so you can see on the left is Mina's stoop, which after construction had started in her neighborhood had spiked really high for lead dust. And Mina spent a lot of time sitting on the stoop. You know, in the city, that's kind of like a front play area. And it came back 44 times higher than what's allowed by HUD for the residential limit for porches. And then here, the picture on the right is, you can see it's a playground, it's a blacktop, and behind it is a construction site. So I took a swab. You can see the area where it's wet, kind of squarish, and I swabbed it before they broke ground over there. And then 3 months later, I went back and I swabbed it again. And so the first time it was 0 micrograms of lead. And the second time when I came back, it was 127.4 micrograms of lead dust. So we were able to use the science to show how lead dust gets spread from neighboring construction sites into areas where kids get down on their hands and knees and play with chalk.
So up to this point, we had looked at all the different ways that children were being exposed to environmental toxins and some of them getting poisoned. So we had looked at first children getting lead poisoned in their old homes. Then we looked at how they were getting poisoned by playing outside in their yards and in the playgrounds. And for us now, the logical next step was to look at the schools. A lot of the schools in Philadelphia are extremely old, and the children spend the majority of their time there. So we turned all our attention to the public schools in Philadelphia. Our editor, the investigations editor, Jim Neff, he came up with the idea to do scientific testing. And we thought in the schools, and we thought this was absolutely crazy because we had no access. We couldn't just walk in a school and say we were going to test. And so we knew we had to, in order to do this, we were going to have to enlist staffers and teachers to scoop up and test a lot of this by themselves. We weren't even sure how to even ask the teachers and staffers how to do it, because we were going to ask them to possibly get near hazardous materials, get on their hands and knees, and do this in the schools. And we spent hours talking with people at labs about what would work and what wouldn't work to test in schools and how to train the teachers. And initially we had no plans to do asbestos fibers. We were just going to look more at lead.
So the first thing we did, of course, was see what documents were available, and this is something that you could probably do. You could talk to the school, your school district, about how they track problems in the school, and are there maintenance logs? Are there work orders? Do they check the building for asbestos? They're actually federally required to. Do they test their drinking water from the fountains? Do they collect asthma numbers? Do they know the shape of the paint and plaster in the building and know whether it's lead? So we went through all these things, and we ended up putting a right to know request in for what's called a school maintenance logs, and in Philly they call it the IEQ Dashboard. It's the indoor environmental quality dashboard, and this is where they track problems within the school. And even though you probably can't read that, this is documenting a mold and moisture problem, the highlighted part, at an elementary school, Kelly Elementary. And obviously mold causes really bad asthma and poor breathing quality in schools. So this is a picture of what the pipe looked like where the mold was. And we had teachers take these pictures for us, which was also really helpful. This here is a close-up of what the IEQ dashboard looked like when we got it from the school district. It was in electronic form, and this is documenting a leaking radiator on the first floor of an elementary school where a section of asbestos pipe insulation needs to be repaired because it's getting damaged from the water. And it had things like the school, the room location, whether or not they had fixed it or not, whether or not it was a repeat problem. We also heavily relied on AHERA reports. So any school built before 1980 will have asbestos building material in it. Asbestos is used around heating pipes as insulation. It's no longer, but it had been used around heating pipes as insulation and in floor tiles for durability. It's sprayed on walls and ceilings as fireproofing and soundproofing. So the school district under federal law is required to take a walk through the school every every 6 months to every 3 years and document what shape the asbestos, where the asbestos is and what shape it's in. And we were able to see here that there was lots of cases in which they had marked asbestos material as a high priority, meaning it needed to be repaired, but it took them years to repair it, or they hadn't repaired it at all. And when asbestos is intact, it's not a problem. But when there's water damage or tiles get chipped, the material can become friable, and it releases fibers into the air. And these fibers are so light that they can drift in the air for hours, and they're like tiny spears that when you inhale them, they will pierce your organs, and years down the road, it can cause all types of cancers. And we thought of we were only thinking about asbestos-related cancers, but it turns out that after talking to many doctors that they've now linked asbestos fibers to stomach cancer, kidney cancer, colon, cancer of the ovaries, esophagus. So there are many different types of cancers that have been linked to asbestos. And you don't get sick for 50 or more years in some cases. So again, these are pictures that teachers took for us of the schools.
So finding the teachers was literally like pulling out hair for Wendy and me. We're not education reporters, and so we had to find different ways, new ways to find teachers willing to test for us. So we used a database of school salaries to identify teachers and staffers in the worst schools with the worst classrooms. We cold called them. We sent direct messages through all kinds of social media, including Facebook. We went to all these different union meetings and conferences, any places where we thought teachers would be gathering or meeting. And we went up to them and told them what we were looking at and whether they'd be willing to help us with the testing. And some of us looked at us like we were completely crazy. We contacted a lot of people through Facebook, and we then got a call from someone in the school district saying that we had been harassing like hundreds of teachers, and we actually took that as a badge of honor. So after we found teachers who were willing to help us or at least talk to us about the possibility of testing, We met them in Dunkin' Donuts, in Starbucks, street corners, parking lots, and we had to train them of how to test. So before we met them, we printed out instructions for both lead, for asbestos, for water, for mold. And then we put the kits together with the vials and the wipes and the labels. And we met them and we went over how to do the testing. We not only gave them the instructions and told them how to do it, we actually did a demonstration for them so they could actually see it visually. From all the documents we had gathered, we used those documents to help tell them and guide them where they might want to test and what they might want to test for. So, say a bathroom with a lot of asbestos had shown up like a year ago, we thought, well, you might want to test there. Some of the teachers would take the kits and they disappeared. We never saw them again. They went dark because they were too nervous to test or they decided not to do it for us, and they disappeared, and so did our kits. Each vial was good for only one test, and we had ordered 500 EPA approved moist wipes at $1 a piece and 500 collection vials, which you see here, for an additional $125.
So once we got teachers enlisted, we asked them to take pictures of where they tested and of the testing itself. And because we had an issue with chain of custody and we knew that the testing would become possibly under criticism because we didn't witness it ourselves firsthand, this was one way we got teachers to help us do verification. And some teachers decided to wear gloves when they did it. Some wore gloves and masks. Some just did it with their bare hands, and a lot of them were really afraid about either losing their jobs or being transferred to an undesirable school in a bad neighborhood. So they would come in early in the morning to do the testing or stay late to do the testing. And in some schools, they were mindful of where cameras were in the building as well. In the end, we got 26 staffers to take 190 samples in 19 of the most rundown elementary schools. And once we got the kits back, we sat down with the teacher and we kind of debriefed them, in the Starbucks or the cafe or the Dunkin' Donuts, and made sure that they did the testing correctly. And if we had any doubts, we would throw out that test. And we had some wacky teachers who kind of ended up not being among those 26. One of them came back and gave us a baggie full of sheetrock. And so, obviously we discarded that. So this is what the stuff looked like when it came in to be sent to the lab. And you can see we asked teachers to label it with the time and date and location of where they took the wipes. And that's the bags that I'm getting ready to take to the lab. There was a lot of trial and error. We were sort of just flying by the seat of our pants. So initially we had bought a whole bunch of sterile bottles, bigger than these vials here, for them to draw water samples from water fountains. And the teachers complained that it was too, that it really stood out. It looked like they were doing a scientific test. So we went back and we asked the lab, is it okay if they just use like a regular water bottle? And the lab said that would be fine. And so for some of those big bottles that we didn't use, the sterile ones, I use them for salad dressing at home sometimes. This is a mom who was really upset to learn that her 10-year-old daughter, who had disabilities and autistic spectrum disorder, was drinking contaminated lead at a school. One of the teachers who took lead from this fountain on the right was very worried about this fountain. It was very old, trough-like, right outside the cafeteria and gymnasium, and she took a picture of this little boy drinking from it, and then she drew samples for us, and it came back extremely high at 44.6 parts per billion. Now the EPA sets a limit for that 15 ppb when you have to take action to to fix that water supply, and you can see that's really high.
So some of the teachers we had were absolute gems. So they would not only take tests of places where we thought there might be something there, they also had they were so aware that this is a pipe where it wasn't even on the teacher's list to test. She walked by it, and it was outside a busy sixth grade classroom, and she thought it looked like something was wrong there, and it looked like very similar to the other places she'd already tested for asbestos. So she took some wipes for us at the base of this pipe and to test for asbestos fibers and settled dust. And we were absolutely blown away because this pipe, the dust at the base of the pipe tested at 8.5 million cancer-causing asbestos fibers. And to give you an idea of how bad that is, experts told us that 100,000 is cause for alarm. And in fact, after 9/11 terror attacks, the EPA agreed to clean up asbestos dust in apartments near ground zero with just 5,000 fibers or higher. And also, when we got some of these tests that were excessively hazardous back, Wendy and I had this ethical dilemma because we were months away from publishing. But should we tell the district of the high results before, or should we hold on to it? And we decided to, out of a public necessity, we decided to inform the district right away. And for both the water fountain and this pipe, and in fact, the school district took down that water fountain the day after we notified them that it had high level of lead in the water.
This is an example of what some of the lab reports looked like when we got them back. And asbestos turned out to be a big surprise. Again, we were just going to do lead in water and lead dust and maybe a mold testing. But we had done one or two, some teachers wanted to do asbestos. And when they started coming back with really high results, scary high results, we kept going with testing for asbestos. And it was the most expensive test. It cost us $85 per wipe because we decided to use a very sophisticated lab method called TEM, and it's the same kind of lab testing that the EPA uses for dust wipes when they do dust wipes. But we were just alarmed at the amount of asbestos all over the schools. And for instance, test results in 6 of the 11 schools came back with 100,000 fibers or more just lurking around in dust. One of the things that teachers complained to us about was construction being done during school hours. And one of the teachers called us during this process, and you can see here that during school hours, we sent our photographer out and she did video and photos, and you can see that the workers are spreading dust all over the place, and it happened to be getting into the school. And one of the workers didn't have a mask on, which was in violation of OSHA regulations because what they're doing is drilling out brick mortar to get rid of mortar that's not in good shape and water is getting through it to put in new mortar. And while they're doing it, they grind it into a really fine powder that you breathe in, and it has silica in it, which is basically ground up quartz, and it will cut your lungs and cause it's a carcinogen that also causes lung cancer and other problems. So this is a teacher sent us pictures of what the dust looked like as it was getting into the school. One is a hallway, the other one is a window ledge in a classroom. And we got the crazy idea to test for silica, and we actually did it, and it was nuts.
So by this point, we had evidence of toxins and environmental hazards in the schools, but we knew to tell the story the right way and completely and get people to care. We had to find children who had been harmed by this. And so this little girl, Ashley Garner, was one of the children we found. She's 9 years old, and she missed 44 days of school in 4th grade because of asthma. In that same school year, she'd made 15 trips to the ER in that same school year. And Ashley's mom was really upset because Ashley only got asthma at school. She never got it at home. And so what we did is we meshed her story with data from the school that showed there were fresh and old mice droppings, cockroaches, and mold that are all asthma triggers, and they were all in her school. This little boy, Lucas Sims, was another human example we found. He suffered from carbon monoxide poisoning while in school. He'd actually passed out along with another child because construction workers were doing work on the roof of his school during school hours. They had a gas powered generator on the roof too close to the air intake vent of his classroom. And so he and another little boy passed out, and other children were feeling kind of dizzy themselves. And in all, after that incident, more than 24 teachers and students landed in the hospital. This little boy kind of broke my heart. He's 6 years old, Dean Pagan, and he ended up getting severe case of lead poisoning from sitting in his first grade classroom where he ended up eating lead paint dust and chips that fell on his desk. There was a ceiling that had like 250 square feet of lead paint over his desk. It was chipping and peeling. It fell on his desk. He didn't want to get up and put the chips in the trash can because he thought he'd get in trouble, and he thought he'd also get in trouble if he left it there because his desk was all messy. He ended up so severely lead poisoned that he was hospitalized with chelation therapy to get rid of the lead. He has lost his ability to do simple math like adding 3 plus 3 in his head. Finding him was not an easy task because we knew that a first grader had been lead poisoned. We knew the name of the school, but we didn't know the name of the child. So I went to the school several days after school, and in fact, school police officers kind of were chasing me away up the sidewalk. And I talked to some parents two of whom said they would try to help me find the family, or at least the child and the family. First, we got the name Dean, and then I had one last name, possible last name. I went to several houses, and it wasn't this family. And so I ended up calling around lots of family names which I thought could possibly be him and his family, and eventually found his grandmother, and then his family, who were gracious enough to sit down and talk about what had happened to Dean. And I met Dean with the little green glasses and could tell his story.
So one of the other things that we did was really different and difficult was we took all the school data because it was the first time that we had so much data on schools and what the conditions were, and we wanted to find a way to empower parents and teachers to know what was going on in their classrooms in real time, like what were the conditions. And so we flowed all that data into something we called a school checkup, and it's a searchable web tool that parents can just type in the school and then look at the classroom, and they can see, is there lead paint? Is there damaged asbestos? Has there been lead in the drinking water before? And it was really our way of trying to empower teachers and parents to demand safer conditions in their school. Um, in the end, really, we got a lot of action and traction, and I think it was just the combination of the testing and the voices of the kids and their parents, and just the time, sustained time and resources. And for instance, the governor pledged $15.7 million in emergency cleanup funding to get rid of lead. And this is a guy that they hired after our project to remediate lead paint in a classroom and do it the proper way. We got a law passed that requires schools to be lead safe before kids can go in them. And that was one of the shocking things that we found, that parents are required under the law to send their children to school, but the school district had no obligation to make sure that they were safe from hazards that would literally give them learning disabilities. We got the EPA to clean up dirt in the river wards, contaminated dirt around lead smelters. We got lots more money in the budget to protect kids from lead poisoning in homes. The school district ended up remediating asbestos in 7 of the worst schools of where we found the most asbestos fibers. So we spent roughly $15,000 on scientific testing over 3 years. And I know that that sounds really daunting, especially if you're with a smaller news outlet. And we don't want the cost to scare you off or the time to scare you off. You can always do this project on a smaller scale or something like it. Maybe, for instance, the lead dust wipes cost us $5.65 for each one for the lab analysis. And so maybe, you just decide to do two of the oldest schools with lots of chipping and peeling lead paint, or maybe you just do one playground around an old industrial site. And I think the soil was $25 $25 to analyze it. So there's ways to do this kind of project even with documents on a smaller scale. So just to give you an idea, this cracks me up. This is when we went to the Center for Health Journalism, USC, for as part of the fellowship program at the start. This is what my kids look like when we started the project, and this is what they look like after we finished the project in July 2018. And they literally turned into the men, and it's kind of funny to look at. But anyway, we'll take questions.
Great, folks. What we'll ask you to do now is to type your questions into the control panel, and then we can read them out to Wendy and Barbara. And while we're waiting for that, one sort of very simple, small question for you. That drinking fountain that proved to be so toxic, it just looks to be a completely ordinary fountain. How would the teacher or you have maybe known that it would be dangerous?
So that fountain is actually very old. It's like a trough, and it dates back. Even though it looks pretty good, that basin style fountain with those four spigots was happened to be an older fountain, and because it was outside the cafeteria and outside the gymnasium, she watched kindergarteners line up all day long at those four troughs, those four water spigots. And she knew the fountain was old, and she just said, you know what, I think I'm going to test this. And initially, when she tested it, she decided to do it the day after they got back from winter break. So the pipes have been sitting a long time, and what happens is the lead builds up in the pipes. And so initially we thought, well, maybe because the water was sitting in the pipes for a while, maybe it was like it was still had lead in it, but maybe after people start drinking from it, the lead content would go down. So we actually then sent her back, and we asked her to do tests at different times of day, in the morning and then in the afternoon, and on two different days after the water had been running a while, and that also came back high. So that's when we called the school district.
Great, thank you. We have a question from Sabria Rice, who asks, how did you protect your own safety while you were collecting samples?
That's a really good
kind of
question.
Funny. We really didn't think of it that much because we were digging up so much soil in the river wards that, I mean, honestly, a lot of times I didn't use gloves. I don't think Wendy did. We just used, I mean, we were careful enough to not touch it, use our shovel and put it in a baggie. But sometimes it was shocking because, we'd be out scooping up all this dirt, and then we get these really high results, and we think, wow, I wonder if we're breathing some of that stuff in. But I don't think we weren't that worried about our exposure. I think the thing that worried us the most is for the children and for the teachers in the schools, because that was really, and we actually had witnessed, we found children who were sick and teachers who were sick. So I think that worried us more.
And we have a question from Ann Joyner. Do you know if similar work has been undertaken at public housing sites?
Oh, that's a good question. I don't think so. I think that there may have been something. I'm not sure it involved testing, but that was an example where a housing high rise was built over an industrial site or something like that. It was an unusual circumstance. But as far as I know, this was the first time that a newspaper had done extensive testing like this. And again, we just thought it was absolutely nuts. But then once we got into it, we just couldn't stop. And some of our teachers couldn't stop either. They just wanted to test and test and test. So we actually had to tell them to cut it. We're done here. We've already your building's contaminated.
Okay, and we have a question about whether you started with a specific budget and just where your funds came from and how you made decisions about what to spend on which elements of this.
So I think. Oh, go ahead, Barbara.
Oh, that's okay. Well, we got two sources of funding from the Lenfest Institute and from the USC. And so we knew that the testing would cost money. And so that's where we thought that we had no idea going in how much the testing would be. So Wendy and I called all different labs all across the region, like in all three states, New Jersey, Pennsylvania, Delaware, all over, and asked the labs like how much the lead testing would be, how much asbestos testing would be. For silica, there wasn't even a lab in the area. Wendy flew it out to I think a state in the Midwest to get it tested. But our editors here approved it because they knew that we were seeing results, we were seeing hazards, and so that's when they decided to go ahead and approve the funding for the testing.
Yeah, but so we did have funding. Initially when we started, we weren't really, we were going to test water. We were going to knock on people's doors and try to get them to test their water. And we were going to use the money for that from the Center for Health Journalism. But we couldn't even get people interested in doing that. We had no takers, and we spent many, many days trying to knock on doors and get people to test their water. And we had some moments where we were like, well, what are we going to, we have this money and we want to do testing, but we don't really know what to test. And so we had some moments of panic, like A, that we weren't going to be able to figure out how to use the money, and B, we would do tests and they would yield nothing. So it was really just kind of like take it going where the story took us. And there was many times like our editors were very hands off, and there were a couple times where I just thought, oh my God, I'm going to get fired because we were spending all this money on testing, and I wasn't really keeping track of it. I'm really bad at that kind of thing. So.
I have a question from Sarah Stewart. How do you convince people to work with you without terrifying them about living or working near toxins?
That's such a good question.
Yeah, that's a really good question. I think with the people in the neighborhoods were, they thought at first we were crazy because, we'd knock on the doors and tell them what we were doing and ask to scoop their dirt. And they were like, you want to scoop what? What? And some people had no idea that they lived right next to a lead smelter, a former lead smelter, or they had no idea what we were talking about. Other people, the old timers, did. And so I would say there were, obviously we found a lot of people willing to test, and it wasn't that invasive because all they had to do was let us in their backyard and scoop their dirt into a baggie. The harder part was getting staffers and teachers to test because we knew what we were asking them to do was on so many levels really difficult. Like they not only had to risk their jobs, find time to do it, and we were asking them to go next to an a possible pipe that had friable asbestos. And we did feel bad about that because we knew they weren't going to, a couple wore masks, but most of the teachers did not. And it was a big ask. I think the reason the teachers, Wendy and I found, agreed to do it is because they really cared about the kids and they really wanted to show that there were hazards in the schools. They saw it every single day, and they wanted to protect not only themselves, but more importantly, the children and the students who, they teach every day. And so that, I think, was the motivation.
And I just want to add that, we thought about that, but the fact of the matter was that the pipes that the places the teachers were swabbing weren't places that they didn't already spend 8 hours a day in, or, probably less than 8 hours. But basically, there's a pipe in your classroom. It's insulated with asbestos. We asked them, what does the pipe look like? They would take a picture. It would look damaged. We'd say, well, do you want to know whether that's releasing fibers? Would you be willing to wipe the floor? I mean, they're getting fibers on their shoes. And what I came to learn, which was really kind of startling, was that people who live in urban environments are all exposed to lead, and we all have some lead in our system, and we also have asbestos fibers in us. Like, it's almost unavoidable. So it's just a matter of how many fibers you breathe in over what period of time, and teachers were really at the highest risk for that. So yeah, they wanted, some of the motivation was wanting to know what they were being exposed to already.
We have a number of questions about um, sort of the school response. And so I'll just read some of them, and maybe, I don't know, you can try and touch on them. Kateri Wozni says, have all the schools tested made changes to get rid of the asbestos since the reporting ran? Margaret Nicholas says, what kind of pushback did you get from the district when you reported what you found? And then Allison Graham says, how did telling the school administrators about the test results affect your story or reporting? Did they know you were testing, and did that help or with access?
Mm. Um, Go ahead, Barbara.
Well, they definitely knew we were testing, and they did question and criticize the methods that we were using because we're not scientists, we're not environmentalists. And so what we did is we had like a sidebar where we explained in detail how we did the testing, how the lab like analyzed it. We were totally upfront that we were having staffers collect the wipes and the tests and in the vials, and so we thought that that was a way to tell. We had to inform the public how we were doing it and not be acting like we did have scientists in the schools. And at the end, like what happened was, yeah, they were very critical of the way we did the testing, because saying it wasn't scientific. But after, especially at the end of the series, what they did is the school district went in themselves and tested the very schools and very spots where we had found high levels, and their test duplicated almost exactly what we had found. And then they decided to go in and clean up those areas that we had highlighted that they had verified that there was a problem. And so they did respond, in the way you'd want them to at the end, but it was a little rough going while we were doing the testing, and also they didn't like that we were talking to so many teachers, and so many teachers and staffers were agreeing to do this testing for us.
And at one point, the school district did try to find out who was doing the testing and try to identify teachers, like who was out sick that day, who came in late that day, that kind of thing. But when we heard that they were trying to figure out who was doing the testing, we let them know that we would be interested in that as a story if that in fact was going on. And so I think they just realized that they couldn't really stop it. And initially, yeah, they were really critical. They kept saying, well, how do you know your tests are right? And we would always say, well, how do you know they're not? Why don't you do your own testing? Like, we just kept saying, if you don't believe our results, do your own testing. And there really wasn't a comeback for that. There really was nowhere to go from there. And I think that's where the science really helped. And we also had a document showing that the EPA regularly uses dust wipes as an investigative tool, and then it does have merit. And sometimes the school district would say to us, well, the teachers are supposed to do a square area. Like, if they swipe more than that square area, inflate it will elevate the numbers of fibers found, and it'll look higher than it actually is. But our response to that was, well, when we find 8 million fibers, let's say we take that square down half, and we find 4 million fibers. Like, what is your number that you think is appropriate? So that's kind of how we dealt with it. We were really upfront. And actually, when the story ran, the school district was happy with the sidebar that said we didn't witness the testing ourselves. We weren't scientists. The teachers weren't scientists. Like, we just spelled it all out.
And we have a question from Shirley Smith. Did you encounter any obstacles in getting public documents, for example, the maintenance logs? And if so, how did you overcome them? And did you tell the administrators of those documents why you wanted them?
Oh, that's a good question. We, I think, I don't think any reporters had really requested maintenance logs before, and so initially they gave them to us willingly. But then what we wanted to find, what we needed was older maintenance logs, because we wanted to prove that the school district knew about these problems not only in the real time, but say 2 years earlier, and the problem still hadn't been fixed. So we wanted old maintenance logs, and when it came to that point, they didn't want to give us that because they sort of knew what was going on, or so they gave us current maintenance logs when we asked for them, but then to do a comparison we had to get those through a source, and we ended up doing that, getting it from a source, and we were able to prove in some instances that a pipe had been flagged for friable asbestos year after year after year, or a mold situation, they would fix it and it would come back year after year. So that was really helpful. But yeah, they didn't want to give us the documents to show what the conditions were like over time.
We have a couple of questions about how you found the children who were sick.
Well, Dean Pagano, the lead poisoned child, we found through going to the school and talking to numerous parents and eventually finding him. But it was many visits to the school, talking to many parents, and luckily parents who were willing to help us find him through like the family name. The child with asthma we found through a source, a nurse source, a school nurse source who knew of this family and the child. We also did find lots of other kids that didn't even make it in the series because they were very similar cases. We found lots of kids who suffered from real severe asthma, and a lot of people who or parents thought that and told us that they didn't get asthma at home. And the carbon monoxide case we found because there'd been actually a little brief a brief in the newspaper that said that there was this little blip accident in a school, and they had taken some people to the hospital, but everyone was fine. Like, it was very minimized and toned down in the newspaper brief, but we figured, like, what's going on here, and was there a real problem? Because we knew that we had several schools where construction was being done during school hours and teachers were complaining. And it turned out like that when we found these kids with the carbon monoxide poisoning, we had no idea that it was that severe where kids had passed out and could have potentially like died from that. And so it was just once we got connected with parents and knew like where to look at different schools, that's how we found, and we had lots of sources who would help us.
We have a question from Lisa Spear. Can you speak about your process of identifying labs to use?
Yes, so for part one, for the series in the homes and then with the dirt, we chose a lab where we felt like, they were easy to talk to. Like, the person we were talking to was willing to work with us and give us prices, and also wasn't terribly skeptical. Was sort of like, yeah, this can be done. and they seemed to know what they were doing, and they had a track record of doing it. Like we knew that they weren't just like fly by night companies, that they were hired by a lot of people to do this kind of work. The problem came actually when we decided to do schools. So, since the schools have to do their own remediation for all kinds of environmental hazards, they use a lot of the firms, almost all of the firms, including Criterion, to do work in their schools. So nobody wanted to work with us. We had a really hard time finding a lab that didn't have a conflict of interest. So what we ended up doing was going with a lab that specialized in asbestos, and this lab didn't do any work inside the schools. They did testing, but they were a lab, and strictly a lab. In other words, Criterion was a lab that did the testing, but they also went out into the field and did the remediation work. So the lab that we picked for the schools was just a lab. They only did analysis, so they didn't have a conflict of interest, and they were willing to work with us. As far as the silica, I called around, trying to find a lab that tested for silica dust, and it was very difficult. And I finally found one in Ohio to do it, and I shipped them the samples.
So we have a final question from Valerie Rengel, who says, I live in an area where oil and gas extraction has sprung up in low income and minority communities. What types of tests would you recommend to uncover what exposures may be in home, schools, and outside services where people are exposed?
That's a really good question, and so for us, for her, I would start with scientists and people who do this kind of work for a living. Ask them what to test for, or what they're thinking. For instance, like we found that there was one school that had a very high rate of breast cancer among the women, but we didn't really know proving it was a cluster was going to be really difficult. And in talking to scientists and doctors, they told us that it's possible that caulking around windows can cause breast cancer, because it's a specific type of poison, basically, but that it wasn't caused by asbestos or lead, that kind of thing. So I think you have to start with the experts, because one of the difficult things for us is we don't know anything about science, so we had to learn a lot about the things, what we wanted to test for, just by talking to doctors and scientists in the field. And so that's what I would recommend doing, calling environmental people who do remediation for a living and asking them what they think, what is the harm, and what is the amount of risk involved.
So I want to thank our two fabulous speakers and echo the comments of one of our audience members, Shirley Smith, who says, I just want to thank the reporters for their tenacity and diligence and for sharing how they went about getting the information for this important series. It's been a wonderful presentation. I want to let all our listeners know that we will have an archived version of this webinar up in a little bit today. And also to remind you that you'll be getting a quick survey asking you to share your feedback on this webinar and future ones that would be of interest, and to ask you to fill that out. Thank you to everybody.
Thank you.
Thank you so much.